Scarlet fever. Seek medical help before it's too late.
What is scarlet fever? Scarlet fever is a bacterial illness caused by toxin-producing group A streptococcus pyogenes, which are found on the skin and in the throat. Scarlet fever mostly affects children and can easily spread to other people. Who is at risk? Scarlet fever can occur in people of all ages. It is most common among children 5 through 15 years of age. It is rare in children younger than 3 years of age. The most common risk factor is close contact with another person with scarlet fever. Crowding, such as found in schools, military training facilities, and daycare centers, increases the risk of disease spread. There is no evidence to indicate that pets can transmit the bacteria to humans. What is incubation period? The incubation period is the time it takes for an infection to develop after a person has been exposed to a disease-causing organism, such as bacteria, viruses, or fungi. The incubation period ends when the first signs or symptoms of the disease appear. The incubation period for scarlet fever is approximately 2 to 5 days. Common symptoms and signs of scarlet fever: high fever, with a temperature of 38 degrees Celsius or more. Enlarged glands in the neck that are painful to the touch. Sandpaper rash. It appears in 12 to 48 hours later with occasional itchiness. On white skin, the rash looks pink or red. On brown and black skin, it might be harder to see a change in color, but you can still feel the rash and see the raised bumps. Sore throat. Strawberry tongue. A white coating also appears on the tongue and peels, leaving the tongue red, swollen, and covered in little bumps. Forchheimer spots. These are tiny red spots on the soft palate and uvula. Pastier's lines. These are pink or red lines seen in the body folds, especially elbows and axilla, during scarlet fever. Desquamation of the skin. This, especially of the hands and feet, ensues in 3 to 4 days, as rash fades, and can persist for 2 to 4 weeks. Less common symptoms and signs of scarlet fever: headache, flushed face, difficulty in swallowing, nausea or vomiting, abdominal pain, body aches. Cough and runny nose are usually not present. Talk to your healthcare provider if your child has a sore throat with a fever of 38 degrees Celsius or more, swollen or tender glands in the neck and pink-red sandpaper rash. Or if your child is ill again, weeks after scarlet fever got better, this can be a sign of a complication, such as rheumatic fever. If you like the content, please consider liking, sharing, and subscribing. You can relieve symptoms of scarlet fever by drinking cool fluids, eating soft foods if you have a sore throat, taking painkillers, like paracetamol to bring down a high temperature. Do not give aspirin to children under 16. Using calamine lotion or antihistamine tablets to ease itching. Medication. You will be given antibiotics for 10 days. Do take the antibiotics exactly as the doctor says to. Don't stop taking the medicine, even if you or your child feels better. Symptoms typically resolve in 4 to 7 days. Prevention. People can get scarlet fever more than once. Having scarlet fever once does not protect someone from getting it again in the future. While there is no vaccine to prevent scarlet fever, there are things people can do to protect themselves and others. Wash your hands. Show your child how to wash hands thoroughly with warm soapy water for at least 20 seconds. Alcohol-based hand sanitizer can be used if soap and water are not available. Don't share dining utensils or food. As a rule, your child shouldn't share drinking glasses or eating utensils with friends or classmates. This rule applies to sharing food too. Cover your mouth and nose when coughing and sneezing. Since you or your child can spread scarlet fever to other people until 24 hours after you take your first dose of antibiotics, keep your child away from nursery or school, and you should also stay off work for at least 24 hours after starting treatment. If you do not take antibiotics, you can spread the infection for 2 to 3 weeks after your symptoms start. There's no evidence to suggest that getting scarlet fever during pregnancy will harm your baby. Complications of scarlet fever. Historically, scarlet fever was a disease with a high complication rate and even death among children. With the development of antibiotics and treatment regimens, scarlet fever is now considered a relatively mild disease. However, complications from delayed, undertreated or untreated group Streptococcus pyogenes are significant. The complications fall into 2 categories. One is suppurative, meaning a disease or condition in which pus is formed and discharged. 2 is non-suppurative, meaning a disease or condition in which no pus is formed or no discharge. Thank you for watching. Please check out the links in the description below for additional information and resources. Also, don't forget to like and subscribe to our channel for more videos like this in the future. Thanks again for tuning in.